Hello, thank you for coming to watch my presentation. I'm going to present my research on epilepsy information management. I'm Aehong. I'm a postdoc at UC by now. I received my PhD in informatics from Indiana University Bloomington. My co-authors are Dr. Wendy Rocha, Katy, Rion, Brattig, Correia, and Shih. I would like to talk about epilepsy and information management first. Epilepsy is a chronic non-communicable brain disorder, and it causes unprovoked seizures. In the world, about 50 million people have epilepsy, and it is one of the most common neurological diseases. There are 6 common symptoms of seizures, such as muscle constriction, anxiety, staring. In addition to seizures, people with epilepsy may experience physical, psychological, and/or financial burdens, medication side effects, social isolation and stigma, and more. Information management is essential to manage epilepsy. However, research shows that people with epilepsy and their caregivers, their performance in information management was relatively poor than people with other diseases. While there are apps for epilepsy-relevant information management and devices to detect seizures, there is not much research on epilepsy information management and technology use. So, our research aims to understand their information management practices and context and challenges, and it also aims to explore potential technology design opportunities to improve their information management. To answer the research questions, we conducted 4 focus groups with 5 people with epilepsy and 7 caregivers. During the focus groups, we asked how they search for information, how they manage information, and what kind of challenges they have, and what technologies they have used. Then, we conducted content analysis and thematic analysis to find common themes from the focus groups. We found that people with epilepsy and their caregivers experience difficulties in finding the right information. They felt information overload because they faced a wide range of epilepsy-relevant information. Although people with epilepsy were all diagnosed with epilepsy, each of them experienced different types of symptoms. This is more challenging for those who have been recently diagnosed. Finding the right information is also more challenging for the parents of babies and young children with epilepsy, because babies and children might not precisely express their feelings and symptoms. Moreover, children could develop different symptoms as they grow up. So parents need to keep searching for new information. We also found that there was complexity in tracking and monitoring data. Each participant had different needs for data entry. It could be the time and frequency of seizures, medications, side effects, and even consequences of seizures, period, because it can affect their symptoms. Due to their different needs, they needed to use different tools in different ways. It became more difficult and complex when they experience seizures frequently, like multiple times every day, or if they have multiple care recipients. Like, one participant had 3 children with epilepsy, so she needed to manage data for each child. We found that sometimes their information sharing was not successful. Especially their doctors were not always available to talk about everyday symptoms. Participants tried to update their doctors and get proper care as much as possible when they visited the doctors. They even tried to send emails in advance, but it didn't work. A lack of epilepsy awareness is also an issue. Participants would like to share information to get support from their family or friends, but they were frustrated when they didn't fully understand and didn't provide proper support. Based on the findings, we developed a design framework that categorized 3 factors that might influence epilepsy information management. First of all, individual epilepsy symptom and health condition. This indicates the types of seizures, triggers, and other personal factors. It can be common or unique. Second, information complexity. It means the types of epilepsy-relevant data and information and tools they need to handle. It can be simple or complex. Finally, circumstantial constraint. It indicates physical, psychological, social, and other situational factors that people with epilepsy and their caregivers cannot control, such as availability of resources or public awareness. Based on the findings and the framework, we suggest a personalized knowledge repository for epilepsy information recommendations. It considers one's unique symptoms and health conditions and their complex information needs. This system could provide optimal information recommendation by collecting and integrating diverse types of data. For example, what, where, and when they experience seizures, what they intake, what they want to see from the system, and other personal information like gender or age, and combining existing relevant knowledge resources. This system would be beneficial for them who deal with unique and complex epilepsy symptoms, medications, or other factors by reducing their burdens of seeking the right information. We also suggest an automated integrated management system. It considers their complex information needs and circumstantial barriers such as limited capability to input data when the person with epilepsy has a seizure. Regarding the challenges of using multiple tools, the system should be centralized and could synthesize diverse functions and tools, such as data from trackers, biomarkers, context-aware technologies, and even complex network analysis system. This system would be beneficial who need to manage various types of data through multiple tools under limited circumstances. Finally, we suggest the social support and care coordination enhancement. It considers social constraints around people with epilepsy and their caregivers. Instead of communicating with their doctors, the system could provide social matching to find other knowledgeable people with similar conditions to get proper help. Also, the system should consider epilepsy awareness. It could consider socio-cultural context, and it could translate epilepsy information in a plain language so that they can help them share information with others. This system would be beneficial for those who experience difficulties in communicating with their doctors or experiencing a lack of awareness by encouraging them to share information in a more effective way. To summarize, we found the difficulties in finding the right information, complexity in tracking and monitoring data, and limited information sharing. Based on the findings, we established a new design framework and suggest personalized knowledge repository system, automated and integrated management system, and social support and care coordination enhancement. Our research contributes to ACCI literature on health information management by focusing on specific issues that people with epilepsy and their caregivers have experienced. We also contribute to epilepsy research by studying information management practices and challenges. Finally, our framework and implications identifies potential design space and directions for future research. This can be applied to other complex or stigmatized chronic diseases. Here are my co-authors. I thank them and the funders for their support. Thank you for watching my presentation. If you have any questions or any feedback, please feel free to reach out to me.